Picture this, you walk into a patient's room and in front of you, you see a floating display, which can be placed anywhere in the room. And the display allows you to view the patient's chief complaint, medical history, medication administration record, allergies, or any labs and tests that are due. This may be a reality much sooner than many of you all think. Meet Apple's new Vision Pro headset. Apple's new headset comes with 23 million pixels. That's like having two 4K displays right in front of you, and you place these displays as close to or as far from you as you'd like. The headset runs for 2 hours on a single charge, and it comes in a battery pack that sits in your pocket and can be swapped out with another battery, or you can plug it in directly to a power outlet. It even has a button that lets you take spatial photos and videos. Imagine getting a patient admission and you notice a pressure injury while you're doing an assessment. As you walk into the patient's room, you can use facial recognition to open up the patient's chart, tap on the button on your headset, and take a photo of their injury. So I work in an emergency department, and when I come into work, I often get assigned as the team lead in the department. That's a nurse that's assigning patients to all of the nurses in the department. And I'm also delegating tasks and getting patients transported from one location to the next. So when I come into work, if I'm going to assign a patient to a nurse, I can envision this headset working in a way in which I can give report to a nurse, and we can both view the patient's medical history and charts as I'm giving report. And when there's a patient that needs to be transported to X-ray, CT, MRI, or ultrasound, wouldn't it be cool if you could communicate with the transporter to come and pick up the patient? And once the patient gets moved from your area to radiology, you can let the headset know that the patient is being moved from one area to the next, and the chart would update accordingly so that everybody else in the department knows exactly where that patient is in that moment in time. And picture yourself as an inpatient nurse. Let's say you're walking down the hall and you look into one of the patient's rooms, and right over that patient's head, you see a sign that says falls risk with a flag right next to it, and it hovers every time the patient moves. So let's say the patient attempts to get out of the bed, or the patient's walking down the hall. You can see this text hover right over the patient's head with the flag right next to it, and it alerts you and lets you know that that patient needs assistance when the patient is ambulating, so you can reduce the risk of that patient falling. Or imagine you're administering medications, and as you're connecting all of these medications to the pump, you might have IV piggyback antibiotics, you might have IV fluids, you might have a titratable drip, and as you're hanging these medications, you get an alert that's hovering right over the medication or the pump, and it lets you know when there's a contraindication with one of the other medications that you are administering. This is what I envision what the future of nursing is going to look like. And the Apple Vision Pro headsets have the potential to make this a reality in the future. The headset also has a dial that allows you to switch between virtual reality and augmented reality. And if you don't know the difference, let me explain. Say you're in a classroom setting, learning to assess a patient and react to an emergent situation. Your instructor places you in a virtual setting like a crowded street where a person in front of you clutches at their chest and collapses to the ground. This is virtual reality, and practicing procedures or understanding how to react to complex medical conditions will all be possible with the help of this new virtual reality feature of the Apple Vision Pro. Or, like I said before, what if you are about to prepare these IV meds or pull them out of a Pyxis or medication cart? Let's say you're looking at the medication vial and you say the patient's room number. The Vision Pro headset would confirm that this is the patient you are asking about by saying the patient's name and date of birth. After you confirm that this is the correct patient, it will show you right in front of your face what the allergies are for this patient, and if the patient has any other medications that might be contraindicated with the one you're about to administer. That is what you call augmented reality. And it's when you are able to view the world with extra digital stuff added on top of it. So imagine if during COVID, you would have been able to transport yourself into a virtual classroom environment where you could immerse yourself into the learning process. I know that for me, personally, if I would have had to go through nursing school while staring at a computer screen and listening to a lecture all day for 1 to 2 years, I would have probably gone crazy. And if you are a nurse who wears eyeglasses, Apple is going to be providing personalized optical inserts that may be tailored to the unique vision prescription of each user. So if you're worried about not being able to see clearly because of your glasses, this feature is meant for you. But let's talk about some of the downsides that come with this type of technology. And the first one has to be the price. Typically, employers are willing to adopt new technologies when the financial hurdle to doing so is minuscule. But when you take into account the fact that it's going to cost $3,500 per unit, a small hospital that needs to purchase 1,000 of these units for 3,000 of its employees will have to spend at least $35 million just to secure these units. And that does not even account for having to pay for the technology that will provide security, which keeps patient data safe and allows you to run all of the programs that I previously mentioned. Even a small hospital would be looking at spending at least $50 million to $75 million just to purchase 1,000 of these units and get them rolling. And I didn't even mention the in-service and training that would be required to get these off the ground. And another thing that needs to be considered and must be said is the fact that nurses are notoriously known for being comfortable with the way things are done and are not quick to accept new technologies in the workplace. Like, I remember when hospitals first started rolling out electronic health records, and a large swath of the nursing workforce in one of the hospitals that I worked in either quit or retired because they didn't want to change nursing as they knew it throughout their entire career. And lastly, one thing that needs to be addressed is the fact that the device only lasts 2 hours on a single charge unless you keep it plugged into an outlet. So you may have to swap out batteries once or twice per shift depending on how long you are using this device. And it has to be said that one should not be expected to be walking around with the headset all day. Rather, you would be able to use it during patient care, and if you'd also like to use it at the nurse's station, you may probably want to leave it plugged in so you can keep its battery charged all shift long. So what do you think about the Apple Vision Pro headsets? And do you think it has the potential to change the future of nursing as we know it? Let me know your thoughts in the comment section below. Like this video and subscribe to this channel for more videos like this.